Devi Sridhar is a professor and chair of global public health at the University of Edinburgh. And she's also the author of Preventable: How a Pandemic Changed the World and How to Stop the Next One. She joins us now live. Professor, thank you very much indeed for joining us here on CNN Newsroom.
Good morning.
Now, as people get ready to disembark from the cruise ship there in Tenerife, are we going to get a clearer vision soon about the extent of the outbreak? Your thoughts?
Yes, I think so. First, all those who are on the ship who are most at risk of getting infected, will be in touch with their public health authorities, whatever country they go back from, and there will see if there's going to be more cases emerging. In addition, we do know there have been individuals who were on flights and other things like that who then tested positive later, and I think we'll know in the next few weeks if any of those have resulted in onwards transmission. The good news is there have been none of those cases, even though a few have been suspected, so that's good news so far.
Okay, good news so far, but the hantavirus, as you pointed out online and to other media sources, the hantavirus has a long incubation period. There is a risk of onward transmission. We know that patients, once they disembark, organized, screened, tested, they will be sent back to their home countries. Will there be a coordinated response when various nations have various protocols in managing the virus?
Yeah, obviously it's tricky because every country with their nationals will want to follow a specific process. But the World Health Organization, who has been leading on this, especially because it's been on a cruise ship with many international, people on it, it's not one government who's been in charge. They will actually be putting out guidance, and they have put out guidance to these governments to say what they should be doing. The clearest thing is basically first few days, look for symptoms, and then ask people to quarantine for up to 45 days. And during that time to monitor and to make sure that they're not in contact with others. What we really want to do is break any chains of transmission so that this outbreak is controlled. It is controllable. Previous Andes strain outbreaks have been controlled, but that's how they've been managed. Basically, you make sure that the virus doesn't have someone else it can move to continue on.
Okay, and Americans are on board this cruise ship, and they will be sent to Nebraska for quarantine and for testing. You said the WHO is leading this process, but the U.S. is no longer a member of the World Health Organization. So is that going to be an issue? What protocols will the U.S. follow to contain this virus?
Well, I guess here is a clear example of why the U.S. decision to remove itself from the WHO was quite short-sighted. In the end, actually, most governments are more reliant on the WHO than they think in terms of times of crises for information sharing, for coordinating with other countries, and for having a seat at the table. That's exactly why the UN was created. In this instance, the Centers for Disease Control, the CDC, has come in at a late stage to say, we're going to manage it from now on. But it is isolated compared to, let's say, several years ago when the U.S. would be leading this. For decades, it was the U.S. CDC who actually led on many outbreak investigations and responses in conjunction with the WHO. And I think that absence has been felt over the past, week or two when this has developed.
Yeah, and just how important is coordination and containment when there is no vaccine, there is no treatment for the hantavirus?
Exactly. I think that's the most, worrying thing, if anything, of this is that we don't have an off-the-shelf vaccine. We don't have a, rapid diagnostic where you could test people and say you're clear. And we also don't have a treatment specific for hantavirus and the strain of Andes. And so I think what you have to rely on is traditional public health measures, which is actually how do you make sure that people who are, unwell, who are infected, get into hospitals, are treated, and that's not passed on to healthcare workers or anyone else? And how do you make sure the general public just isn't exposed to this? It looks like right now that has been the case, that actually we've not seen any unlinked cases to those who have been on the cruise ship. But it's also, a sign that we need to invest in infectious disease research. It's easy to forget about these things until they come back in this form. And that's why we need to have that kind of research and platforms in place to prepare for things like this in advance.
And finally, advice. What's your advice for people who are watching this and they're concerned? They're concerned about traveling. They're concerned about the virus coming to where they are. What precautions should be taken given the uncertainties that are there?
Well, right now, I actually would say the risk to the general public is very low. I wouldn't change anything in your daily life, and the experts I know in this area aren't changing anything in terms of what they're doing. Obviously, if you're going through major airports, if you're traveling and you're worried, you can always wear an N95 or, a mask, and that can make you feel a bit more protected. But that's not just for hantavirus, that's for all the things that are circulating. But other than that, I think actually right now we just have to wait and watch to see if we see more cases that are unlinked to people who are directly on the cruise ship. And right now we haven't seen that. So I think people really shouldn't be worried right now, but it's wait and watch over the next few days and next few weeks.
Thank you, Professor. Really appreciate your advice and your insights. Professor Devi Sridhar joining us live. Take care.